Everyone, my name is Keith Grant, Senior Assistant Director for Infection Prevention at Hartford HealthCare. Here to give some update with myself and my colleagues about the COVID-19 vaccine. Over the last 24 hours, a few set of news came out, some of what we've been, eagerly waiting for. Obviously, over the last, I'd say, 4 weeks, a number of news, very interesting, very exciting from a clinical medical community, from an epidemiology community, from a general overall community, knowing that the possibility of a true safeguard to this virus is on the horizon. So just to recap, Pfizer, Moderna, the two primary vaccine companies that are producing or that have produced and are going through processes right now with the FDA, ACIP, and different industries and different regulatory bodies in order to get them approved and ready for distribution and for vaccination. We've seen efficacy of greater than 94% overall, so that's very, very good news. And then, now the next step was to get to the FDA advisory group. FDA advisory panel met yesterday to discuss primarily the document and result of the Pfizer studies. And based on the evidence that was produced to that panel, their advice and their recommendation is to go ahead and grant the EUA, recommend granting the EUA. So the question that we've been getting, and rightfully so, is what's the next step? So just want to focus on that just for a little bit. So what happened there is a group of scientists looked at all the data that we've had, and they look at all the benefit, they look at all the obvious risk and any adverse reaction and side effect that these studies have, and based on that, make a decision, send it over to the FDA, and then the FDA decides whether or not to grant an EUA, but with their recommendation. This morning, the Secretary of Health and Human Services report that they believe that the FDA should and will grant the EUA. So obviously there's a meeting coming up and we're waiting for that as well. So, a lot of good news, a significant amount of work that's been put into this process over the last few months. There's a significant amount of anxiety and eagerness that's awaiting for this process. But as I stated before, there's still a few hurdles to go over. But as it stands right now, it seems like the biggest hurdles for us was for this group reviewing all the data point and deciding whether or not their advice to the FDA would be to move this forward. And as of yesterday, it is stated that the FDA advisory group panel recommend the use of the Pfizer vaccine to go forward. Another question is, does this mean the vaccine is ready to use? Not just yet, right? So we still have a few more processes to go through. So our expectation within by this weekend, we should have significantly more information. And in some community, there's a belief that by this weekend, we'll have enough authorization that we can move forward for distribution and hopefully administration as well. Still tremendous effort that needs to be done with distribution, still tremendous effort and logistic that needs to go through with formulating or solidifying a plan across health systems, across communities. There's still a lot of information, and there's still a lot of us relying on the community to pass information on to ensure that people are ready and prepared and informed so when this vaccine is available. I have Eric Arlia, who is Chief of our Pharmacy Operations. He's going to talk a little bit more about the vaccine and the processes here at Hartford HealthCare.
Thank you, Keith. Good morning, everybody. My name is Eric Arlia. I am the Senior Director of System Pharmacy here at Hartford HealthCare. And this is a very exciting day for us. We've been waiting a long time for this. Lots of excitement and anticipation. Getting ready to get those first COVID vaccine clinics up and running as quickly as we can has been our biggest focus for quite some time. So to be on the cusp of that happening is very exciting. So I just want to take you through a few steps of how we're going to get from receiving the vaccine to administering it to some of our healthcare providers. So as Keith mentioned, we expect that FDA emergency use authorization approval is imminent. Could come as early as tomorrow. All along, the CDC and the FDA have been telling us to be prepared to receive the vaccine within 24 hours of emergency use authorization. So we will be on the lookout this weekend. It is possible that the shipments could come this weekend. Our understanding is that our supply will probably come out of Chicago, where there's some massive ultra cold storage facilities that have been put together. It'll arrive here in Connecticut and be transported by a carrier service to Hartford Hospital. We'll take all of our supply for Hartford HealthCare here at Hartford Hospital. We expect to receive 1,950 doses in this first shipment. We don't yet know how many we'll receive in future weeks. We're hoping to get more information on that soon. So obviously, the vaccine will come in the shipping containers, which have been well publicized, specially designed for the Pfizer vaccine, have dry ice in them, and they're able to keep the vaccine in the transport phase at the negative 80 degrees Celsius that it's required to be in. We'll receive it here at Hartford Hospital. We will transfer it into our ultra cold storage facility. We have been preparing our early clinics, knowing that we have 1,950 doses. You'll recall that here in Connecticut, we're sort of splitting this first phase between nursing home residents and healthcare workers. So we're focused on our healthcare workers here in our system, and we've been going through an exercise all week to try to identify the healthcare workers that have the highest COVID risk exposure. So all of our clinical leadership teams at each hospital and Hartford HealthCare have been reviewing their rosters. We've split our allocation of 1,950 doses up proportionally based on the size of our institutions. So each of our sites know how many doses they have to work with in week one. We'll identify a subset of high-risk providers, and we'll vaccinate as many of them as we can in week one, and we'll continue that process through the next couple weeks as more supply comes through. We've tentatively scheduled our clinics to begin next Wednesday. I think with everything we've learned in the last 24 hours, I feel very confident that the vaccine will be here in time to support the plan that we have been tentatively working through. We'll have clinics at all of our acute healthcare facilities over the first 5 days of varying time lengths. We will, as we get ready to actually start the clinics, the pharmacy team here at Hartford Hospital will begin the defrosting process. We'll defrost it here at Hartford Hospital. We will transfer the appropriate amount of doses in specially designed vaccine transport containers. We'll be transferring it at refrigerator temperature. The vaccine is good for 5 days at refrigerated temperature, so that will give us plenty of time for it to get to each of our acute care facilities and be positioned for our clinics. Once it's in the clinics, our pharmacists and nurses who will be providing vaccinations will reconstitute the vials. Each vial has enough vaccine in it for 5 individuals. The Pfizer vaccine is a powder, and we did also receive supply kits yesterday from the CDC that have saline and syringes and other supplies that we'll use to administer the vaccines in our clinics. So we'll reconstitute the doses and we'll be drawing up the 5 doses per vial, and that's how we will start the administration process. We'll probably do about 1 provider every 10 minutes per vaccinator at each site. We'll have no issues going through that first 1,950 doses. So it's going to be a big week. We're all really excited about it. We're really excited to be able to begin to offer some immunity to our healthcare workers who have been working extremely hard and at extremely high risk, helping to care for COVID patients. So it's something that we're all feeling really good about. So with that, I'm going to actually introduce Dr. Patrick Troy now, who is going to go over a little bit more about the evidence and the information and why we're so excited about the efficacy of the vaccine.
Thanks, Eric. Patrick Troy, Division Director of Pulmonary Critical Care here at Hartford Hospital. So I think those of you who have heard me talk on this topic before know what I'm about to say. This is essentially the moment that we have all been waiting for. From the early days in the COVID pandemic in March and April, when we were slogging through and fighting as hard as we could for each patient's life in the ICU with the nurses, the therapists, the advanced practitioners, and all the staff. What we were hoping for at that moment was something that could change the game entirely. And I think what has happened is over the course of the spring and into the summer, and now as we face a pretty challenging winter as numbers are rising again, one thing I know is we feel really competent, very competent, and I'm very confident in our capacity with my partners and team to be able to treat patients who get COVID. But what we really didn't have until just a couple of weeks ago, right, was true hope that we could turn this arc around, change this narrative. And I have to tell you, I'm working in the hospital this week in the intensive care unit. There is a noticeable pep in everybody's step over the last 7 to 10 days. People are feeling very good, not only about how well we're doing treating patients with COVID, but also for the first time, the possibility that we can begin to really crush this curve downwards, that there might actually be a light at the end of the tunnel. So my message today is pretty simple. I'll reiterate. The Pfizer vaccine is very effective, 95% effective across age, gender, and race. It is even more effective in terms of patients from a severe COVID perspective. That's the business end of what I'm dealing with in the ICU with our therapists, nurses, and advanced practitioners. Almost 100% effective in that population. The vaccine is safe. Although the vaccine moved very, very quickly in terms of its development, we've talked about the technological reasons behind that. We've talked about the tremendous financial investments that allowed for that to happen. So it's not that safety along the way was ever compromised in this process, and that's important. So we have a safe and effective vaccine. And I will stay here till the cows come home and answer questions on the safety and effectiveness of this vaccine because I believe in it that much. From the beginning, people in this state have been so fantastic in terms of asking healthcare providers, myself included, Patrick, Dr. Troy, what can we do? What can we do to help you? What can we do for the ICU? I've had people drop off antiseptic wipes, brownies, masks that they've knitted or their significant other has knitted and brought in. All of that is fantastic, and we appreciate that. What I have told people before is, what I need you to do is to wash your hands, wear a mask, and practice social distancing. Now I'm going to offer you something different. I'm going to offer you a profound choice so that when you ask me, what can I do to make a difference? I have a definitive and clear answer for you about what you can do to make a clear difference. You can get the vaccine, right? And by doing so, you are doing the right thing for your health and your safety. But it is much more than that. You are doing the right thing for our community, for your family, your friends, your neighbors, your coworkers, and your classmates. And yes, by doing that, you're helping all of us here across the state in terms of healthcare and at Hartford HealthCare in particular. Now, in saying that, I would never ask any patient or the community to do anything that we ourselves as healthcare providers would not be willing to do. So we will be happy to show you that the vaccine is safe. We will be happy to have it administered to us first. We'll be happy to talk about what happens after we get it and how we feel. We are that committed to this process to convince you that it's that important. So when I summarize how I feel about this, it would really be that you have control for the first time, right? Real control beyond the important. And I'm not downplaying the importance of masks, distancing, and hand washing. That's what's been able to help contain this. But this control is different. This is a choice that you can make, but I want folks to think about the choice being more than the terms of just for you. Yes, it's the right thing for you and for your health and for your safety, but it's so much more than that. It's about our community, and in doing so, the more of us that are vaccinated, the more quickly we are vaccinated, the more we will see the arc of this narrative about COVID change. We can get control back over this pandemic. We can do it rapidly, but we're all going to have to do it together to make that happen. So with that, I will turn it back over to Keith, and I think he's going to entertain some questions.
All right, with that, we'll open the lines for any questions about anything we've said or any questions about anything pertaining to, Hartford HealthCare's collaboration with the community and as we go through this pandemic itself.
Hi, everybody. It's Matt Karen at Fox 61. I had a couple of questions. On the panel, their vote to authorize this, there were 4 people who voted not to recommend the vaccine. I'm just wondering, from your perspective, is that common to have this sort of a split panel? And have you heard any reasons why they may have some reservations?
Yeah, so this is pretty common for a number of not just vaccines but other medications per se that are seeking EUA. So obviously a lot of, I shouldn't say skepticism, but there's still people within the scientific community that would probably ask for more time, more data, more time to monitor patients that have been given a second dosage, for example. So a lot of reservation is still around this, but yeah, 17-4 that's unanimous, obviously. But for those 4 individuals, we've seen the split within the community, even regarding just mask wearing per se. So this isn't uncommon at all.
Thanks for that. Earlier in the week, I asked you about the allergic reactions that there was some concern about in the UK.
Mm-hmm.
What have we learned more on that since then? And it's my understanding that this vaccine really is not made up of any of the common ingredients that would trigger a typical allergic reaction, like preservatives or eggs or anything like that.
Good. That's a good question. So, one of the things that, and we've been getting a lot of these questions. So keep in mind, this study, not just this vaccine study or trial, but it's ACIP recommendation that if you've had significant allergic reaction, to include anaphylaxis, you should be very cautious when taking the vaccine. Work with your healthcare provider to possibly set up some form of process. You shouldn't just go get the vaccine. And if you look at the individuals who were impacted, these 2 individuals, healthcare providers who were impacted, of which we're speaking about in the UK, these were people with history of anaphylaxis. They were treated immediately and appropriately, but these are individuals that does not fit into the actual study group. In fact, anaphylaxis was an exclusion criteria for the Pfizer study. So, which is again consistent with most vaccines.
Right. Just one more for you, if I could.
Sure.
The governor signed an executive order earlier in the week, which I read it. It allows for the vaccine to be given to people 10 years of age or older, but it's my understanding that this Pfizer vaccine wasn't tested on anybody younger than 18. So I'm just wondering, if we have any information, if the FDA is going to recommend it to be given to people as young as 10 or not, and what we know about the vaccine in younger people.
So that's a very, very good question, and I think that's a communication and a question that obviously, the governor and his team has done an exceptional job in the state of Connecticut through this whole process, collaborating with the health system, a huge partner with Hartford HealthCare. So I know not just with the governor's office, but we're still looking through this data, and there's a lot of information we're putting forward, and will constantly say this. It has the opportunity to change. If you look at what's coming out from the initial Pfizer study and the documents that we've just started getting this week, clearly you see, where age is concerned, where if you're just looking at the actual study itself, there's obviously limited data. So I don't know how to answer if the question is, will the governor change his recommendation? And if the next question is it justified to have it from 10 years and up? There's no way for me to immediately answer that, but based on the data, I understand that question is justified, and I assume the governor and the advisory group is still working out a lot of kinks into many of these recommendations that will come out with this vaccine.
Hey everybody, this is Emily Brindley from The Current. I'm not sure who would be best to answer this question, but I was wondering if you could kind of walk me through what percentage of Hartford HealthCare staff you expect to take the vaccine. I know that, in the general public, obviously that's been a big question about how many people will trust the vaccine enough to actually receive it. So what percentage are you estimating will take the vaccine once it becomes available to them?
So I'll start the question, and Eric has some more information on that. So what we've done, a few things, obviously. We have a limited supply of vaccine Hartford HealthCare, we serve a significant population of patients and colleagues, so healthcare providers, right? One of the first things we've done is identified like what's our critical care areas that's going to be most at highest risk that immediately really quickly fit into that 1A, tier 1A. So these are the people in your emergency departments, your people in your critical care units, anesthesiology group who are doing high risk procedures such as intubations and so forth. And then based on that, the next question would have to be, based on the numbers that we do have, the number that we're getting allocated, what percentage of these folks do we imagine will immediately get the vaccine? And keep in mind, the folks at Hartford HealthCare understand the gravity of this and their commitment to the community. The majority of Hartford HealthCare colleagues, I will more than most likely sign up for this. But what we have to do is, we did a survey, and I think Eric has some results on the survey that he can share.
Yeah, so a couple of follow-ups on what Keith said. There's kind of two parts to this question from my perspective. We have about 30,000 employees here at Hartford HealthCare, plus some non-employees that work in many of our acute frontline areas. So a little bit over 30,000. We have identified roughly, I'm going to just speak in kind of rough terms, about 7,000 of those people are what we would consider to be in higher risk areas. Where they care for COVID patients on a regular basis. One of the things I wanted to point out about that too is it's not just the providers and the nurses, it's the aides, it's the environmental service workers, the food tray passer, the pharmacy staff person. Some of the areas we look at by the unit, if it's a unit that cares for COVID patients, and some of it's by profession. Just as an example, a respiratory therapist by job class is someone who has a higher risk. So it's really combining a lot of different data sets together, but we're roughly looking at about 7,000. So if you remember, we were going to get about 2,000 doses in the first week. So, if we were able to, if we were going to continue to get that amount of vaccine, it would take us about 3 to 4 weeks if 100% of our staff wanted to be vaccinated. Now, as Keith mentioned, we are also surveying our staff. That survey is still open, so we don't have the final results yet. But my understanding from at least the early results is that at least 60% of our staff has indicated that they would almost definitely or highly likely to take the vaccine as early as it is offered. So, we're going to continue to monitor those survey results, but those are just kind of some of our rough numbers of what we're looking at here. I would love nothing more than to see our allocation next week go up. It would be great if we could offer that high risk group of about 7,000 colleagues the vaccine sooner rather than later. But knowing that not 100% of them will take it, I'm still hopeful that, in the 3-week, maybe 3.5-week time period, we can give them all an opportunity to get the vaccine.
And I just want to follow up on that because you said 60% said that they would were very likely to take it as soon as it was available.
Yep.
That feels like a pretty low percentage to me. Does that percent concern you at all? And do you have efforts underway to try to get that percentage up?
Yeah, I think, us here this morning is really an effort for not just our own colleagues, but to have everybody feel more confident in the vaccine. We'll have many educational campaigns. We'll target different types of employees. We might do some different informational sections for, professionals. We might do some different ones for some of our other trade or service workers. Yeah, it will be a focus of ours to help to make sure that our staff feels confident in the vaccine and is more interested in getting vaccinated. And I think Dr. Troy has some comments he'd like to add to that as well.
It's Patrick again. So I'll just add to that. So we've made extensive efforts through these presentations and throughout the hospital to give dedicated presentations to our respiratory therapists. I myself and my partners have sat and talked with nurses, with therapists, with advanced practitioners to answer the questions. And I think one thing that's important is, yes, we're all healthcare professionals, but the questions they have, I'll tell you what, they're a lot like the questions that my patients ask, because this is a new process. This is a different process, and that's okay. So what we want to do is we want to flesh out all those questions, get them all out in the daylight, answer all those questions so that people feel comfortable with this process. I mean, yes, 60% is not 90%, but what we're seeing, like I said earlier, is we're seeing active movement towards more and more enthusiasm around this vaccine. And I think what you're going to see, quite frankly, is that when the first dose of the vaccine comes out, hopefully, as Keith said, this weekend, early next week, people get it, and then they see that nothing happened, everyone's okay, then that's going to generate even more enthusiasm, at least within my sort of particular element, which is the intensive care unit. There is overwhelming enthusiasm sprinting towards this vaccine. So I think our efforts will continue on reiterating safe and effective, and then answering a lot of the questions. These are good questions, and that's a process that we have to work through.
And I just have one last thing, and then I'll let other people ask questions. Is there any consideration from Hartford HealthCare's perspective on requiring the vaccine for staff members, particularly for staff members working with vulnerable populations? I believe that that's something that you guys do with the flu vaccine. So is there any thought on requiring a COVID vaccine for staff?
So the flu vaccine actually isn't mandatory. There are exceptions for it. The catch there being that you have to wear a mask for the entire flu season. That's been our policy for a number of years. My understanding, and I can certainly let Keith speak to this as well, is that it will not be mandatory. We will not insist on the vaccine. However, having said that, our goal is to convince everyone that it's the right thing to do.
This is Mike Savino with Channel. Oh, I'm sorry. Was anybody else, before I jumped in, was anyone else going to say anything on that question?
So, yeah, sorry, Mike, before you start. So just, like Dr. Troy says, there's a lot of information that's coming out on this. There's a lot of people that's feeling overwhelmed by the information that's coming out. There's documents that we've tried to summarize, and even the summary is overwhelming. We had one summary document that's 28 pages. Obviously 28 pages is not a really good summary. So, there's a lot of information that's going to come out over the next few weeks to complement this. I think a lot of people have a lot of questions about the processes. The distribution, there's a lot of people have questions about where they fall in line with, this tier system. One of the things that, we just want to keep in mind, this is a state and this is a health system that when we accepted that, universal masking was necessary, we went to 100% masking across the system. When we accepted that, we're supposed to practice social distancing and physical distancing. This is a system, a group of healthcare providers that advocated for this process, supported this process, and exemplified with their actions throughout the system and throughout their community. So, the numbers as it stands right now, 60%, I think, for people, 60% of people who probably haven't had the opportunity to review all the data, that has put their hands up, that they're ready to do this. I think that's a high number. The next step is people having the opportunity to sit down and have more discussions, and a lot of that is on us, from Rebecca, Tina, Nick, the entire team, Dr. Troy, myself, Eric, Dr. Kumar, Dr. Ulysses Wu. Is for us to pass on the appropriate information as soon as possible for people to get it to read and summarize. So hopefully that helps.
Thank you all. I appreciate it.
Yeah. Mike?
This is Mike Savino with Channel 3. I just wanted to sort of continue on this conversation, and more so with the community, and how does Hartford HealthCare hope to reach people, especially people who might be skeptical of doctors already? How are you going to try to reach them to convince them that this vaccine is safe?
Mike, that's a good question, but it's not just Hartford HealthCare, right? So we will keep doing what we're doing, and we will expand that. So we will, work with our community leaders, work with our faith-based organizations, work with our institutions that we know have a bigger platform within the community than we do. And, work with the media group, work with you guys, and try to get the right information out. I think that's our responsibility. That's going to be our primary responsibility. The responsibility of the federal government and the FDA and Pfizer was to provide this vaccine for us. Our responsibility is to ensure that it is here in Connecticut, and we're setting up the appropriate facilities in order for it to be distributed, allocated, and administered. And then our next big step is to ensure that the appropriate messaging is going out to our community to ensure that, people are getting that information and coming and getting vaccinated. And this has worked before. So we've seen, a state that's gotten some level of information. If you told people a year and a half ago that you would be wearing a mask when you're going into Walmart, there's no way this would be an acceptable practice. We've managed to pass this information on, and it's worked. It's worked well in the state. So I think we have a huge responsibility coming up. We're not even close to the finish line at this point in time, but we have very good news and very good hope at this point. Any other question? Eric or Dr. Troy, anything you guys want to say before I close up? Tina, anything? All right, guys, until the next set of information come out, we will be committed to, be on here as soon as any news breaks or, anything encouraging or discouraging comes out about this vaccine and this vaccine process. We'll ensure that we keep you guys updated. Thank you so much.